Hello, my dear students. Today we are going to discuss a very important topic for your exam point of view, that is pulpotomy. So, when it comes to pulpotomy, first we should start with the definition of pulpotomy. So, let me tell you in nutshell what is pulpotomy is. Pulpotomy is nothing but you are removing the coronal portion of the pulp and keeping the radicular portion of the pulp vital so that you can maintain the vitality of the teeth. So, that is, I am just giving you a nutshell of the definition. So, when it comes to definition, you need to write a proper way. So, pulpotomy, according to Finn has defined pulpotomy as a complete removal of the coronal portion of the dental pulp, followed by a placement of a suitable medicament that will promote healing and preserve the vitality of the teeth, which means that you are removing the entire coronal portion of the pulp. So, in that, after removing the coronal portion of the pulp, you are keeping a medicament that will promote healing and preserve the vitality of the teeth. So in nutshell, this is the schematic diagram here. So this is the caries process, and the entire coronal portion of the pulp is being removed. Then you are keeping a medicament here. This is the medicament over here. So you are keeping a medicament over there so that will promote the healing of the radicular pulp. So this is the radicular pulp. So this entire radicular pulp, if there is any infection or anything is there, that healing will take place and preserves the vitality of the teeth. So that is what is the definition of pulpotomy says. So next thing is, again in nutshell, again we can split it. So you guys will have a confusion that regarding pulpotomy and pulpectomy, right? So what do you mean by pulpotomy? Pulp means your pulpal tissue. Otomy means incision or making a cut. So that is what this is what is called as pulpotomy. You're cutting the coronal portion of the pulp. Okay. And what do you mean by pulpectomy? Pulpectomy means your pulp, again it's a pulp. Ectomy means surgical excision of the part. You are removing the entire thing. Entire radicular pulp is being removed. So you can see here the entire radicular pulp is being removed. So your pulpotomy means only a cut or an incision is made. So only the coronal portion of the pulp is being removed. Now coming to the objectives. Why you want to do a pulpotomy? The main objective is removal of the inflamed and infected coronal pulp and thus preserving the vitality of the radicular pulp and allowing it to heal. So basically, you need to remove the inflamed pulpal tissue. Okay, inflamed pulpal tissue has to be removed. Then you need to preserve the vitality of the teeth. You need to maintain the tooth in the arch. Okay, you need to maintain the tooth in the arch because the tooth that retains in your teeth act as a best space maintainer. So when the tooth is there in your arch, what happens? You are able to masticate. You can eat food. So masticatory function will be taken care. So basically, the main three objectives of pulpotomy is removal of the inflamed or infected coronal pulp, thus preserving the vitality of the radicular pulp and allowing the radicular pulp to heal properly, and maintains the function, then maintain the tooth in the dental arch. Next in your flow chart, okay, next in your flow chart, it comes the indications. Where and all I can do the pulpotomy procedure. So in indications, the cariously exposed teeth, when there is a retention is more advantageous than extraction or replacement by a space maintainer, which means that you need to retain the tooth in the dental arch. If you want to retain the tooth in the dental arch, you can go for a pulpotomy, which is cariously effective. And clinically and radiographically, there are signs of radicular vitality. Okay, in clinically or radiographically, you can see that the caries is approximating the pulp. It's not involving the pulp, it is just approximating the pulp, and there is no radicular or interradicular radiolucency present, which shows a clear picture that your radicular pulp is vital or your radicular pulp is healthy. Then next, your pain. Your pain, if present, which is not spontaneous and persists after removal of the stimuli. Soon after the removal of the stimuli, just imagine you are eating something, when the food particles enters in that particular cavity, you will get pain. Once you are removing the stimuli, you are fine. Okay, so that is another indication because it's spontaneous pain. Spontaneous pain means you are not having any issue of you are not having any issue of irreversible pulpitis. The pulpal status is mostly like a reversible condition. Next is the main important thing. Your tooth should be restorable. The tooth is in a condition that you can restore and maintain the function of the tooth. Then when it comes to the root side, okay, the root length should be minimum of 2/3 of the root length. The normal root length, it should be minimum of 2/3 of the root length should be present. Okay. Then next is the clinically very important thing, because in your viva was say they might ask you this, the hemorrhage, okay, the hemorrhage that comes out of the pulpal when you do an access cavity preparation, when the pulp get exposed, the hemorrhage from the abutment side will be bright red, and you will be able to easily control it. So it shows a clear picture that the radicular pulp is vital, the pulpal condition is very healthy, and it is a reversible stage. Now, next coming to the contraindications. So, we now spoke about the indications of the pulpotomy. Next comes the contraindications, where and all we are not supposed to do a pulpotomy procedure. First is your root length. If your root length is less than 2/3 of the root of the normal tooth, then you are not supposed to do a pulpotomy, which means that the root resorption exceeds more than 1/3 of the root length. Then the crown is non-restorable. Imagine the crown is completely fractured and you are not able to give a proper restoration. In such cases, it's better not to go ahead with the pulpotomy procedure. Then next is the blood. If it is highly viscous, sluggish, and absent hemorrhage. Absent hemorrhage means if there is no hemorrhage at all when you are doing an access cavity, when you remove the roof of the pulp chamber, and if there is no hemorrhage at all, which means that the tooth is non-vital. In such cases, you are not supposed to do a pulpotomy. So if it is highly viscous or sluggish or dark red color of bleeding, which shows that the entire pulp is being infected. So in such cases where you are not able to control the bleeding, in such cases, don't try to attempt for a pulpotomy. Then marked tendon percussion. Imagine that the signs of furcal involvement is being shown when you are pressing it. Okay, when you are asking the child to bite, the child is having pain. Better don't do a pulpotomy. Then mobility with locally aggravated gingivitis associated with partial, or if there is a mobility present in the tooth, either can be because of gingival infection or inflammation, or because of an abscess present. Okay, if there is an abscess present, obviously there will be a slight mobility of the cases. So in such cases, also try to avoid doing this, but because it's properly contraindicated for this particular clinical scenarios. Then next is total radicular pulp necrosis, which I have already mentioned. Once when you are doing an access cavity preparation, and there's no bleeding at all, which means that the entire radicular as well as the coronal pulp is necrotized. Such cases is also contraindicated. Then radiolucency exists in the furcal or periradicular areas. The both furcation area and periradicular area, you are able to see a radiolucency. Okay. Then persistent toothache, if there is a furcal abscess present. Okay, in such cases, it shows a clear indication that your radicular pulp is also in an irreversibly damaged stage. Now, once again, I hope till here you guys are clear. I hope indications, because when you are getting a question as define pulpotomy and what are the indications, these are just the tips I am telling. So if you write this, you will be able to you'll be able to complete the flowchart of a pulpotomy procedure. So I hope till here I am clear. Okay. So next, going to the classification of pulpotomy. So your pulpotomy is broadly classified as two things. Okay. One is vital pulpotomy and next is non-vital pulpotomy. Fine. So there are two classifications. Again, I repeat, there are two classifications. Two headings are there. One is vital pulpotomy and next one is non-vital pulpotomy. You can see in this diagrammatic picture. Then in vital pulpotomy, there are three procedures that is done. One is devitalization, next is regeneration, and third one is preservation. Again, I repeat, in vital pulpotomy, there are three procedures that is done. That is devitalization, regeneration, and preservation. Okay. Then according to the removal of coronal tissues, how much coronal tissues you remove. According to the removal of the coronal tissues, it is again classified as partial pulpotomy and complete pulpotomy. So these are the two classifications based on the vitality. We will say that vital pulpotomy and non-vital pulpotomy, and based on the amount of removal of the coronal tissues, you can say it as partial pulpotomy and complete pulpotomy. So now we will be discussing in detail about the three different types of vital pulpotomy, that is devitalization, regeneration, and preservation. So in that, first one is devitalization, or you can say it as mummification or cauterization.